Dear fellow Canadians and other entities of Earth, what are nurse practitioners? Where do they come from? Where do they come from? And why are they here? All that today here on Questions Asked, Questions Answered. Let's begin. So dictionary.com says, a registered nurse who has received special training for diagnosing and treating routine or minor ailments. Well, that's vague, don't you think? So I went on over to the Canadian Nurses Association website, or CNA for short, and found a better definition. N.Ps are registered nurses who have additional education and nursing experience, are health professionals who treat the whole person. We know they are pretty much exactly like their general practitioner, also known as the doctor as they're commonly called. But don't confuse the two, as a difference in years of education as well as scope does differ between the two, although that continues to narrow, but it still doesn't mean to jump off the GP bandwagon for an NP if you have one. But it does show that being seen by an NP isn't avoiding you of your primary healthcare needs. Fun fact, but in 1999, an Ontario study estimated that NPs are capable of handling 82.6% of patient care, with the remaining percent requiring referral to a physician. Okay, although that doesn't explicitly tell us what an NP is, it gives us a better idea. So I want to bring up their education, training, where they work, and what they are licensed to do. But first, a quick trip down memory lane. Once upon a time in a strange land called Canada, there lived a strange group of medical practitioners in the rural areas. They treated and helped those who came to them when help was too far away. And this is how they lived until the year of 1967, when the first education program appeared in Halifax, Nova Scotia, for registered nurses or RNs in the northern nursing stations. In the next decade, it continued to evolve and evolve, becoming a better and better program, with reports appearing supporting an expanded role for RNs in the realm of primary healthcare. But that support faltered in the 1980s when a strange, narrow-sighted group perceived an overabundance of physicians and a lack of money, legislation, and public awareness of what an NP was and could do. The end. So with that all said and done, from the 1970s all the way to the future, 2012, they practiced and practiced, not because they were nefarious and roguelike, but more because the perceived need of legislating NPs into the primary healthcare system didn't seem at all feasible. I mean, physicians are eternal and there is an overabundance of them. Wrong. Eventually in that year I just mentioned, the federal government of Stephen Harper passed the new classes of practitioners regulation, which finally granted NPs an official place in the healthcare system. And all it took was about 2 decades. Better late than never, I guess. So like I said, in 2012 the practice was legislated, which meant that education programs for NPs now needed formal approval from the provincial or territorial regulating nurse agencies. Unfortunately for this, or not, depending on your point of view, this can lead to unstandardized core graduate studies, clinical experience, and program length, with the CNA also noting that they also need graduate education with clinical experience to practice at an advanced level, that is, above a registered nurse. But if people's reviews on NPs are anything to go by, they still do an amazing job. So to summarize, because this could get really confusing if I ramble on about education for too long, NPs need to have a graduate education in nursing, pass an exam through the National Council of State Boards of Nursing exam program, and successfully register within the appropriate province or territory in order to begin practicing. Wow, that's a lot of work. So they're essentially advanced nurses with advanced education, with advanced training to allow them to effectively provide top-notch healthcare services. The list of things they can do is pretty long, so we're going to give you the stuff you're more likely interested in. The main things they do is promote health, disease and injury prevention, cure and rehabilitation. In addition, they also provide wellness care, diagnose, treat illnesses and injuries, screen patients for chronic disease and patient monitoring. They are also allowed to prescribe uncontrolled drugs. Don't worry, it's not as nefarious as it sounds. Think Tylenol. And interpret the results of screening and diagnostic tests. They work in different medical settings, ranging from community healthcare centers to emergency departments. And fun fact, again, they operate largely autonomously, and that just means they can begin patient care, monitoring, and if something falls outside of their scope, they can collaborate with other healthcare practitioners in other medical centers. And that, in a nutshell, is a nurse practitioner. They are advanced level nurses with an ever-closing knowledge and practicing gap with general practitioners, and if people's reviews of them are anything to go by, they are doing a fine job overall. But that's all for today. If your finger is twitching, it might just be subscribeitis. The best cure to that is to click that strange red button on your screen. You know, the one that says subscribe. Don't worry, it won't bite. And don't forget to share this video too. Let's all cure subscribeitis together. And hey, now that I've given you the cure to what ails you, I'll let you free to wander the beautiful world. So go out, have fun, and make sure to come back next time for your next dose of questions asked, questions answered.